the nice thing with the concierge service is the camp is assigned to one of our practices. I should say that Pediatrust is a supergroup comprised of 12 different in the Chicago suburbs. We would assign one office to the camp and specifically one lead physician in that office. From 9 to 5, Monday through Friday, or 8 to 5, that physician would sort of be the one that was going to handle the vast majority of the telemedicine visits. Overnight, weekends, holidays, then it would be the others in the office. But again, still just one office for them to know, and really one doc in particular. Some of the other services that we provided, not mentioned, I didn't put this down on the slide. We went over an equipment list. These are the things you need to have in camp. Most of them do that every year, but there were a few that took our recommendations and said, oh yeah, we don't have that. That's a good idea. We review their standing orders. We assist with the policy this year, obviously very important, regarding surveillance testing. How are they going to surveil? How frequently are they going to do that? Who's considered okay at what point, and all of that stuff. These camp directors were pretty knowledgeable, but still they needed some fine tuning with some of their plans. We also provided analyzers, the machines to run COVID tests, obviously, and strep tests, and then all the supplies and test kits for that. At the end of the summer, we'll get them back. So we didn't charge them for that. We said, here it is. And then for the test kits, they'll just return whatever kits they don't use, but we will charge the insurance. If the camper does not have insurance that we accept, then the camp is responsible for that, and then they can figure out however they want to either bill the camper or the family, or just reach into their pockets and pay it, and so be it. We offered to train their health staff if needed, not only on COVID stuff, but specifically how to use the analyzers that we give them. We talked to parents on a general webinar. A lot of these camps have a webinar 2, 3, 4 weeks before camp, just doing all the information. It's often very long, a couple of hours, and our doc would go on for 15, 20 minutes, whatever it takes, to give a face to a name. This is Dr. So-and-so. She will be the physician who's the lead physician attending to your child, and answer any questions that come up on the webinar. And then offering to talk to or meet with one-on-one through some sort of Zoom meeting, any of the kids who are chronically ill or have special needs, should that occur. Many of those kids obviously have their own camp, right? Diabetes camp, asthma camp. And I don't know if it's the COVID thing or what. Many of our camp directors this year say they really don't have very many of those kinds of patients this year. I think people are still a little cautious if they have a special needs child, but we do offer that. And then because all of this started, back in fall of 2020, there's been a million changes since then. Obviously, vaccines, the difference in different recommendations in mask wearing, even the different recommendations about what to do in camp has changed from the official CDC guidelines. So we've just been keeping up with that and making sure that we're all on the same page, communicating regularly with the camp directors. Most of the work is going to be done before camp starts. Once camp gets underway, we feel like most of our work is done. Then it's simply just doctoring, and it's all the preparation ahead of time that really is very time consuming, which is one of the reasons why we charge a fee. It does take time.